One of the founding mothers of social work, Jane Addams, once said that action indeed is the sole medium of expression for ethics.
We are thrilled that you are here watching because we are going to engage in social action as we keep an eye on the National Association of Social Workers Code of Ethics.
The Code of Ethics calls on us to do this, while paying particular attention to the needs and empowerment of people who are vulnerable, oppressed, and living in poverty.
The social work with core values of service,
social justice, dignity, and worth of the person are the foundation of our unique purpose and perspective.
We believe that this is what unites us as a profession, regardless of age, gender, race, or political affiliation. We are united by our shared values and the profound belief in opportunity for all, and the idea that everyone deserves a chance to reach their full potential.
Now, we also believe that these core values are currently being challenged in profoundly troubling ways.
So, what can we do about it? You might ask. Well, we want to tell you you're in the right place.
In this video, we will strive to understand the person and environment paradigm and understand how legislative and political advocacy intersects with clinical social work practice.
We're going to learn how to be part of broad-based coalition, build partnerships, and work with both allies and opponents.
And we're going to have the opportunity to hear from social workers who have lived experience fighting to expand the possibilities of individual achievement, social workers who have first-hand experience of promoting social justice, fairness, and equality.
We'll be discussing the advocacy strategies that can help the proposed groups as well.
Today, there are several groups of people who are considered to be oppressed as social workers. Your job is to help these people speak on their behalf and help them make changes in their lives and their culture based on your knowledge and level of expertise.
Social work specializes in helping people by helping themselves through advocacy, policy changes, and raising a voice to someone who may never have been heard.
Advocacy, by definition, is engaging in purposeful action that will help people advance their right opportunities, causes, and human dignity. Sounds like a job of a social work.
Doesn't it? That's because social workers follow what we call a code of ethics. This code of ethics was written by the National Association of Social Workers and states that their purpose is to socially and economically help vulnerable groups.
Seek the right resources to get the proper help they need in order to not only survive, but to thrive. Social workers believe in empowerment through advocacy to improve these groups.
the use of proper family dynamics with an organization are functioning to community service and policy guidelines to achieve their goals through proper advocacy.
There are two forms of advocacy case. Advocacy which involves one case, an individual or family that requires there to be some type of change made when dealing with the case advocacy.
The goals are to meet the absolute needs of a person to ensure their survival for a short period of time.
Things such as healthcare, food, and water. Because advocacy involves a large structure or systemic effort to change policies, practices, procedures, and laws to achieve social justice for a large part of society.
The goal for a cause is to see involved causes that promote human dignity as well as long-term things such as employment, equal status before the law, and social injustice.
So why do people need an advocate? You might ask, well, some people are not able to provide themselves at a certain point in their life or at all because life has been made that way for them.
This could be due to mental or physical reason, lack of social or education like the public resources, or the effects of hopelessness of not being able to get out of thoughts, as well as not being able to get out of poverty.
The social services and programs that have been put into place by policies and laws are supported by activists and social workers through advocacy.
In advocacy ethics, the social workers are required to behave in a professional or skillful manner. The Code of Ethics in the National Association of Social Workers, or NASW, helps the social workers to see their purpose, which is to advocate the enhancement of a living environment that will help produce a healthy and safe place for people.
Social workers are also advised to use the Code of Ethics to approach, initiate, assist, educate, and organize clients' participation in their effort in advocacy.
Now, let's take a look at advocacy broken down into levels that will make or that will better help us understanding how social workers use in life advocacy.
At a micro practice level, it would include supporting clients in the courtroom or educating clients to educate themselves advocacy.
At a meso-level practice, this would include working to change policies and practices in personnel in an organization that would make organizations accountable for the welfare of those who they represent.
And creating new relationships with other groups to better help those in need advocacy. At a macro level, who would include educating people about social issues, conducting research, and data on needs.
For those who need to campaign for new laws, they tackle oppression and discrimination that you now see a lot of laws and policies today.
It started and moved their way through these levels to where they are now, where the country can hear and see them.
Some of these issues are healthcare reform, lesbian, gay, bisexual, transgender, or LGBT rights, mental health, and drug use, affordable housing, and climate change, as we've discussed.
Social workers utilize the general social practice model, while the advocacy practice model or policy model is a similar model and only for its advocacy.
Particularly, it's divided into two theories and two perspectives, which is systems theory and empowerment theory.
Since advocacy takes place for all size system, anyone including a community can be a client.
A social worker could advocate for the community to seek better preventive measures to avoid pregnancy, such as proper education or contraceptives.
Empowerment theory, both case and cause advocacy, involves social workers building relationships with their clients in order to participate in the impact decision-making process, such as what we've learned or experienced.
When dealing with advocacy is crucial because social workers give all the attention to both the problem and the client has.
And the strength within their life to help them promote changes. Everyone has strength and meet in things that they can bring to the tables to support their changes. Things like resources, abilities, relationships, education, knowledge, skills, energy, and passion. These are all considered strengths.
Finally, the ecological perspective describes when advocating for a change.
It is important to take into consideration that person or groups whole environment, things like technology, building, water, or animal could also be a strength or a challenge.
For example, the phone and internet can be both cases or cause advocacy.
Some people are having issues to advocate themselves because they do not have an access to internet or other technologies to communicate with others.
Overall, we believe advocacy and activism is so crucial in this field.
Because, like we have explained, social workers are the voice for a change. Not only are they the voice, but they are alongside those who are advocating.
For they are taking top time effort,
Sweat,
Blood,
And tears.
To be heard.
In the changes that are to be made.
And without social workers, the oppressed would remain in limbo and not knowing what to do,
Or where to go or who to talk about whatever problems they face.
Workers' Corner, an advocacy and social action for professional social workers.